How to use the sperm concentration male fertility test. This video is for illustrative purposes only. Refer to the product insert for the full instructions of use. What you will need for the test: 1 pouch containing a test and a dropper, 1 bottle of staining solution, 1 bottle of washing solution, and 1 collection cup. You will also need a timer. Note, the cup comes with white powder at the bottom. Don't worry, the test has not been used. This is just liquefying powder, which is essential for the test to run correctly. To prepare for the test, refrain from any sexual activity for 3 to 7 days prior to using the test. This ensures volume and quality of sperm is at its peak, so the test can give you accurate results. Do not use the test if it's expired or if the pouch is damaged. Collect your semen sample via masturbation directly into the collection cup. Make sure that no hands, tissues, condoms, or other foreign materials come into contact with the sample. Do not use sperm samples collected over 12 hours prior to testing. Shake the sample gently in the collection cup and let it stand for 15 minutes at room temperature. Remove the test cassette and the dropper from the pouch. Using the dropper, collect some of the sample. Then, place 1 drop of it into the well marked A on the test cassette. Once the sample has soaked into well A, take the bottle with the yellow cap labeled sperm concentration staining solution and add 3 drops of the blue staining solution to well A. Then, wait another 1 to 2 minutes. Take the bottle with a white cap labeled sperm concentration washing solution and add 2 drops of the transparent washing solution to well A. Let the solution soak in the test for another 1 to 2 minutes. If the color of test well A is the same color or darker than the reference well B, it means that the sperm concentration is 15 million per milliliter or greater. The likelihood of conception is higher with this sperm concentration, though other factors such as ovulation play a role as well. If the color of test well A is lighter than the color of reference well B, it means that the sperm concentration is less than 15 million per milliliter. This is known as oligospermia. The likelihood of conception may be lower with this sperm concentration. Discuss your results with a healthcare professional. If well A is colorless, it means that the sperm concentration is less than 5 million per milliliter or 0. This condition is known as severe oligospermia or azoospermia. Discuss your results with a healthcare professional. If you're unsure of the result or feel the result is inaccurate, you can repeat the test using a second test. Just make sure to refrain from sexual activity for 3 to 7 days beforehand. If the second test is still abnormal, you should discuss the result with your doctor or a medical professional.